Okay, so today I would like to introduce to you the coming soon device, Gonioscoop, which is coming, will be launched in ESRS for the CE mark region. And I'd like to introduce some clinical information and also product information in this session. And for the next session we have next week, we will be providing more marketing information and other details of the product. And before starting, let me just state a couple of things. So we will be recording this webinar and upload to the Nidek support library. So I know there's a lot of information on this webinar, so it's difficult to process in one time. So we will be uploading the video and also the material on the Nidek support library after all the sessions are finished. Okay. Okay, so let's start. If you have any questions during the webinar, please comment on the question section, and I will be answering after or during the webinar. Okay, so for most of you, I believe you haven't seen the device yet. We haven't been displaying in Latin American countries, only in ASCRS and AEO in America. So if you've joined there, you've seen the device. But here is one thing I believe that the Gonioscoop will be for the market for the ophthalmologists. So I truly believe the Gonioscoop is the innovation that we have been waiting for. And today I'm going to explain why I believe so and why I think this is an innovation for the whole ophthalmology. So for a brief introduction, gonioscopy, we say it's an automated gonioscopy. Gonioscope is an automated gonioscopy. And we can say that we have very different functions in this one device. And of course, these functions are important, but it's not only the functions that I want to state, it's more the solution we can provide with the Gonioscoop. So as you can see, it has a very different shape from other devices we have now. And it's something I think very new for Nidek as well, and also for the market. So the main goal for this webinar, of course, is to sell a lot of Gonioscope after it's launched. And this is something as a sales people we want to do, of course. But to do this, to achieve this goal, we have to know how to promote the GS-1, the Gonioscope, as well. And for that, we have to set a target. And our target is not only glaucoma surgeon, but it's also ophthalmologists in general, doctors in general. But most of all, to understand and to sell gonioscopes, we believe that it requires for everyone to understand at least a little bit about glaucoma and also the angle, so-called iridocorneal angle. At least to talk to the doctors and state what are the points and the solutions we can be providing for them. So we divided the webinar into sections. So today we are going to do section 1. We are going to be introducing a little bit about glaucoma, gonioscopy, and also introduction of the device, and talking about surgery and treatment for glaucoma. And as I said before, the next week, the second session, we will be talking about marketing issues and clinical cases. Okay. And both of the webinar will be recorded and uploaded on the Nidek support library again, for you to not forget. So you can review afterwards and keep studying after this webinar as well. So first, let's start with the introduction of glaucoma. So I believe you're already familiar with the word glaucoma and at least know one or two things about glaucoma. So as you can see in this picture, on the bottom, glaucoma is a disease that will affect vision, resulting in vision loss. And this is a disease that damages the optic nerve. And for the studies, most of the time it's believed that it happens because of the fluid will build up within the eye and increase the eye pressure of the patient, and the increased eye pressure would damage the optic nerve. So this disease will lead to blindness if it's not treated. Okay. And these are some data delivered by some papers. So in 2018, this year, the glaucoma population worldwide is more than 60 million. And in 2 years, in 2020, it will be estimated to increase to 80 million glaucoma patients. And what about the cure for glaucoma? So there's not a cure yet for glaucoma at this moment. So the only thing we can do with glaucoma is progressing the disease. So it cannot be cured 100%, it can only be stopped at the current status. So if it's not treated, it will lead to blindness, and if it's treated, it will only stop the progression of the disease. And we say glaucoma in one word, but if you open the box, there's a lot of types of glaucoma. When we say glaucoma, we're dealing with primary glaucoma, secondary glaucoma, normal patient glaucoma, acute angle glaucoma, developmental glaucoma, and so on. And even in these categories, we have several different smaller branches of glaucoma. So even if we say glaucoma, there's many types of glaucoma. Okay. So I just want to remember that there are several types of glaucoma, and if you wanna study more, please go ahead and study, because today we're not gonna be looking at one at a time. We're gonna just review the whole glaucoma. So I explained that glaucoma is caused by the fluid that builds up within the eye and increases the eye pressure. So what is this fluid? So this fluid is the same as the aqueous humor. So this is a liquid that is made in the ciliary body, and this liquid will flow to the anterior chamber through the lens and the iris, as you can see in this picture. So it will go to the anterior chamber, and then this will leak through the angle, which is here. So when this flow is not done properly, this liquid will start building in this area, and then it will eventually increase the eye pressure of the patient. And with the increased eye pressure, it will damage the optic nerve. So now let's see what's the angle. So we have the angle, and we have the trabecular meshwork. So these are two words I want you to remember today, and if you want to study more in detail, there are a lot of textbooks available online, so you can do that. But today we'll just review these two structures. So the angle is something, it's called the iridocorneal angle. It's where the cornea and the iris meet. That's why we call iridocorneal angle. Okay, so this is where it will drain the aqueous humor from the eye. So, and if you look closer to the angle, there is a structure called trabecular meshwork. So this is a tissue located within the angle. So it's one of the structure that you can see in the angle. And this is like a filter to leak the aqueous humor. Okay, so we have the iris here, we have the cornea, and this is called the angle, right? And then we have trabecular meshwork, which is in the angle. So this is the image of the angle to have a better idea. So we have a 2D sectional image, we have a 3D image, and this is a gonioscopy view. It's not gonioscope, it's just a regular gonioscopy. So as you can see, it's very difficult to distinguish which structure is what. But if you draw a line here, we can have a better idea what's where on the angle. So I'm not gonna details in this webinar, but if you can review afterwards, or you can study deeper if you want to. But as you can see, we have anterior and posterior trabecular meshwork. So this is the structure that it's the filter for the eye, the angle. Okay. So now we glaucoma and the structure of the angle. Let's review about gonioscopy. So this is a guideline from the European Glaucoma Society, and we also have guidelines from the American Academy of Ophthalmology stating about gonioscopy. So gonioscopy is mainly stated as one of the most essential examinations for glaucoma diagnosis. So not only in Europe, but also in America and Japan and other countries as well. So if you have, if you know any guideline in your country, in your region, please check that and tell us if gonioscopy is there as well. So in this guideline, there's 4 examinations. There are 4 examinations that are essential. They're the must for glaucoma diagnosis, which is intraocular pressure, of course, fundus examination, perimetry, and gonioscopy. And we did a brief comparison of the examinations, the gold standard, and also the Nidek products that we can offer for these alternatives, for these examinations. So for IOP, for the tonometry, of course, we have the applanation, which is a gold standard. And as a Nidek, we can deliver the NT series or toner series. And as you may know, applanation is a contact to the cornea, and NT series and toner is a non-contact method for tonometry. And for the second examination, we have visual field, and as a gold standard, we have the Humphrey from DICE, and as an Nidek, we can offer the MP3. And for fundus imaging, the gold standard will be fundus camera, but also now with introduction of OCTs, it's becoming more common for doctors to do OCTs instead of just fundus camera. And of course, as Nidek, we have the RS series, RS Advanced series as our OCT. And for the angle, examination of iridocorneal angle, we have gonioscopy as gold standard, which is using the lens and everything. And now, as Nidek, we didn't have, but now we have the gonioscope, so we can offer a full examination device for glaucoma diagnosis. So I explained that gonioscopy is a very important examination for glaucoma. However, let's see the reality if it's really done properly. So there are several studies that show that gonioscopy is one of the examinations that are not performed as it should be performed. Let's see one source from American Medical Association state that gonioscopy was performed only 46%, about 46% of the cases in the first visit. And also other sources state that only about 50% of patients receive gonioscopic exam. You must think gonioscopy is a must for glaucoma diagnosis, but as I showed in the slide before, this slide, it's not performed as much as it should be. You can see other examinations, we have 98%, we have 96%, 92%, but gonioscopy will have only less than 50%. So we must think why. And for the reason, I believe there are several reasons, a couple of reasons that can be thought. The first one would be probably gonioscopy is a must, but maybe it's not necessary to diagnose because we have other technologies such as OCTs and tonometry that we can diagnose patients with glaucoma even without gonioscopy in some cases. And also other reason can be the examination itself. So let's have a look in gonioscopy. What is gonioscopy? So these are the steps, the easy 20 steps to do gonioscopy, to perform gonioscopy. So as you can see, there's a lot of steps and it can be complicated just to look at this slide. And this is not something I am saying, this is stated in a book called Gonioscopy. But if we summarize those steps, the very 3 steps, basically the doctor will use a slit lamp, a gonio lens. We'll place the gonio lens on the patient's cornea, and then we'll see the structure of the angle through the slit lamp and gonio lens. So often the doctor will rotate this lens on the patient's cornea and see the entire angle. And as you can see, this is a very troublesome examination. It may be time consuming and also not very comfortable for the patient. Okay, and here is some of the items that you need for gonioscopy. So of course we need the anesthesia because we're going to be contacting the patient's cornea, and also slit lamp, the gonio lens, and of course the doctor in the consulting room. So as you can see, we have different types of gonio lenses to do the gonioscopy. And from the next slide, I'm going to be explaining a little bit about the gonio lens. So first, we have mainly 2 categories of gonio lens. So we have the direct gonioscopy, the direct gonio lens, and we have the indirect gonio lens. So as you can see in this picture, it's showing very easy the difference between them. So in the indirect gonio lens, we have a mirror inside the lens. So you'll be looking at the angle from the mirror, through the mirror. So you'll be looking at the reflection of the angle. And for the direct gonio lens, you'll be looking directly to the angle. And the main difference between these 2 lenses is that the indirect gonioscopy is done when the patient is sitting, the sitting position. So when the patient is sitting in the consulting room, the doctor will use this lens to do the examination. And for the direct gonioscopy, it can be either when the patient is sitting and also when the patient is laying down on the surgery room. So these are 2 different types of gonio lens. So now we have looked at the gonio lens. Let's have a look at the gonioscopy itself. So there are mainly 2 to 3 types of gonioscopy. So we have the static gonioscopy, we have the dynamic gonioscopy, and indentation gonioscopy. So sometimes dynamic and indentation is classified as the same examination, depending on the region. So today I'm going to talk about static and dynamic / indentation. So the static is a regular procedure where the doctor will put the lens on the patient's cornea to see the angle, and will rotate the lens without any pressure on the cornea. We'll just place the lens on the cornea. And the dynamic and indentation gonioscopy is performed when the patient has a closed angle in the static gonioscopy. So if the patient's angle is open, it's okay, but if the patient's angle is closed, the doctors have to do dynamic or indentation to see what is the cause of this angle closure. If it's something organic, if it's something schematic, the doctor will have to look further to see and to diagnose properly the patient. So as I said, it's performed in closed angles, and the doctor will usually use a different lens from the static. So it will use a smaller lens and will pressure onto the cornea. Okay, so with this pressure, it will see if the angle will move or not. Okay, so these are the two different types of gonioscopy. Let's go to the next one, which is the grading system. So we have looked into the lens, the type of the lens, and we have looked into the type of gonioscopy, and now we have to see how we can classify the angles. So there are a couple of more different grading systems, but today I'm gonna introduce you 3 types. Okay, so first we have the Van Herrick, which is only done by using the slit lamp light beam. So for this one, we don't use the gonio lens, and the doctor will classify the patient's angle status by the gap between the light beam on the cornea and on the angle. Okay, and as a second choice, we have the Scheidt grading system. So this system will classify the patient's angle depending on which structure can be seen on the angle. So as we saw in a couple of slides ago, there's a lot of structures in the angle. So depending on which structures the doctors can see through the gonio lens, it will be a different classification. So for this one, we use the gonio lens. Okay. And as the third one, I'm going to introduce to you today is the Schaffer or the modified Schaffer grading system. So this grading system has 2 different criteria. The Schaffer method uses the actual angle to see and to classify the angle. So this is a view we can obtain with, for example, UVM. Okay, and we'll classify based on the degree of the angle. And the modified Schaffer is a modified version of the Schaffer method, which will evaluate and classify the patient's angle status, like the Scheidt method. So depending on the structure visible, it will have a different classification. Okay. So I know it's a lot of information, but as I said before, we will be uploading this material so we can have a look after, we can review, and also we will have different sources, references, so you can check those too to study even further. But here I want you to understand that there's different types of classification as well. And it's going to be even better if you know which classification method system is used commonly in your region or in your country. So depending on each region, each country, doctors tend to use different types of. So as we reviewed the type of lenses, the type of gonioscopy, and the type of classifications, and this is the order that the doctor will do the gonioscopy. So first, he will only use the slit lamp to do a Van Herrick method for a quick assessment of the chamber, the anterior chamber, and the angle. And then the doctor will do the static gonioscopy. Okay, so he will now use the lens to put on the patient's cornea without any pressure and to see closer the patient's angle status. Okay, and the doctor will do a further investigation, detailed investigation with dynamic and invitation gonioscopy if the patient has some kind of closed angle or closed suspect angle. Okay, now we've reviewed one examination floor of gonioscopy. Now what we have to do, we have to record these findings. The doctor will record the findings that he had on the patient. So again, this one, we have several different types of record systems, which we call the goniogram. So there's different types of goniograms around the world. So it's going to be nice if you check which goniogram or grading system, recording system is used in your country. But one major is the Becker's goniogram. So the doctor will have this kind of drawing already in the patient's information. And he will draw and paint based on what he found in the patient's angle. Okay, so as you can see, from the type of lenses, the type of gonioscopy, type of grading different systems, and also recording system, gonioscopy is a very time-consuming even after the examination. And these are the findings we can obtain with gonioscopy. Of course, we can see if the patient's angle is open or closed. This is one of the main reasons to perform gonioscopy. And the other major reason to perform gonioscopy is to properly diagnose the patient's glaucoma. As I showed you before, there are several types of glaucoma, and to evaluate and to diagnose the patient properly, it is important to do gonioscopy and to see what is the type of glaucoma that this patient has. And of course, as we can see in color image, the gonioscopy, we will be able to see pigmentation, also neovascularization, and also inflammation that can be seen only with color image. And not only that, but we also can, the doctors can also plan for the surgery or the treatment. Okay, so of course, this is not only gonioscopy, but with other examination as well, such as tonometry, perimetry, OCT examinations. So the doctor can evaluate and diagnose which glaucoma this patient has, which state of the glaucoma, and what treatment can be done for this patient at this moment. Okay. Now we reviewed how gonioscopy is, what is gonioscopy. I'd like to introduce to you the awaited gonioscope. So as we have been reviewing about the conventional gonioscopy, so the gonioscopy is the gold standard practice for glaucoma diagnosis. But as we said before, not all doctors practice this examination. Not all doctors perform this examination to the patient that has to be performed. And one of the reasons that we can think about is because it's very complex examination. So what we want to do with our automated gonioscope is to make this examination something more familiar, something more standard, something that everyone can do, and perform more gonioscopy. So as an image, I would like to ask you to imagine the tonometry, applanation tonometry with non-contact tonometry. So of course, the non-contact tonometry is a screening examination, and if the values are high or abnormal, the doctor will still perform tonometry, applanation tonometry on the patient. So we want to do something similar with the gonioscope. So we want to make a gonioscopy a standard with gonioscope, and then if the doctor finds something abnormal, he can perform the indentation or dynamic gonioscopy on the patient afterwards. So briefly introduce some of the functions of the gonioscope. So we not only designed and developed the device, but we also designed a special lens for the gonioscope, as you can see in this image on the right. So this is a gonio lens that was designed specifically for the gonioscope, which has 16 different surfaces. And this is a mirror coated surface, so if you look from the inside, you will be able to see it's a mirror. And this design enables the physician, the technician, or the doctor to perform gonioscopy without rotating the lens on the patient's cornea. So this will be able to capture the full angle without rotating the lens. And also we have the angle detection in the device. Okay, and to capture one area in this lens, one surface of the lens capture one area of the eye, and this will be able to capture in 1 second. So to do the full capture, it takes 16 seconds, and with the alignment, it will take less than 2 minutes to perform a gonioscopy. And also, as you may have seen some of the images, we have the linear and circular stitching function after we acquire the full capture image. And of course, we can store data and also export into the report format. So this is the examination procedure. Here I will just introduce you briefly, because we will have a how-to video uploaded very soon in the Nidek support library. So you can use that as a reference. But to show you today in this slide, I will just state to you some of the main steps. So we have to lock the lens position. We place the lens onto the device. We apply the gel. So we will be providing a gel as well. Okay. And then we will put the lens on the patient's cornea and then acquire the images. So this is the capture screen. So as you can see, this is the patient's eye. And you can see some green dots here. So this is the angle detection I was mentioning before. And those square is the alignment square. So if you put those green dots within the square, the outshot function will be activated, and then it will start capturing. But like I said before, a how-to video will be coming soon, so this is much easier to understand than me saying to you on the slide. So once we have this how-to video, we will be able to watch it and then have a better idea. So, but since now we don't have yet the how-to video, I will just explain how the machine, the device, the gonioscope is actually capturing the images. So this is an image of one area of the eye. It's about 2 by 2, okay? And what the gonioscope does, it will capture 17 different focus. So this is the same area, and we capture 17 different focus in 1 second. Okay. And after capturing one area, the device will keep capturing other areas of the eye as well. So we will do 17 different focus for each area of the angle. And this is more or less the time that it takes to do the gonioscope. And then we finished one capture, one full capture, okay? And after that, the device will automatically select the best focus for each area. This is done by the software. And of course, you can choose different focus if you want to manually. And then you can stitch all the image together. Okay. And for the stitching, we have two different stitching. So of course, we'll have the individual images, and we'll have the circular stitching that I just showed you, and also we have the linear stitching. Okay. So, and this will provide the doctors a very innovative view of the angle, because up to now, we didn't have this kind of image in the market. They only could see a part of the angle through the lens, but we never seen this kind of image in color up to now. So this is a screen image when we capture. Okay, so you will have on the bottom part is the 16 different area that I mentioned. So this is a different area section of the eye. Inferior, nasal, you can see, check here which area you're looking at. Temporal, superior, okay. And on the right side, we have the 17 different focus. I know it's a lot of 16 and 17s and a little bit difficult to understand, but we will be doing trainings and demos in the future congresses, and we will be telling about that in the next session. So once we have the chance to do demonstration for you, we will do, okay? But from now, let's keep with the screen. So these are the 17 different focus for this particular area. And as you can see here, the star mark is where the software selected the best focus for the angle. Okay, so for the data exporting, we have the USB and LAN cable, 2 USB ports, 1 LAN cable port. And when you export to EMR, the report format will be exported in the PDF format or PNG format or JPEG format. And there are 3 types of report. We have the single capture mode, full capture mode, and also stitching mode. Okay. Okay, so now we reviewed about the gonioscope. Let's proceed to the glaucoma surgery and treatment. So, same of glaucoma types, we have many different techniques of glaucoma surgery and treatment. So these are some of the glaucoma surgery that we have now in the market. And also we have several different kinds of medications available in the market as well. So we have the trabeculectomy, which is one of the gold standard surgery for glaucoma. And also, of course, we have the MIGS, which is very hot topic these days. But today, I'm not going to talk about all the information, all the surgeries. We'll talk only about a couple of them. But in the material we will be uploading to the NSL, we will have a more detailed explanation of each surgery. But before talking about the glaucoma surgeries, I would like to ask you, what do you think is the most common technique to treat glaucoma? So I will do a quick poll. So I'd like you to answer this question. So what is the most common surgery for glaucoma, to treat glaucoma? Let's wait about 30 seconds. Okay, we have most of the people answer. Okay. Okay, so I will finish the poll. So these are the results of the poll. So most of you answer trabeculectomy, which is one of the gold standard technique for glaucoma surgery. And some of you also answer trabeculoplasty. So let's go back to the slide. Okay. So believe it or not, the most common surgery technique to treat glaucoma is cataract surgery. So up to this day, cataract surgery is still one of the main surgery techniques for glaucoma treatment. And because, as you know, in the cataract surgery, we'll be exchanging the natural lens, the crystalline lens, to an intraocular lens. So the lens thickness will be reduced, will be become thinner. So this will make a space into the anterior chamber. And this will allow better liquid flow. As I explained to you before, the fluid made in the ciliary body will go through the anterior chamber and go leak from the angle. And this will actually result in lowering the patient's intraocular pressure. Of course, not all glaucoma patients are intended to have a cataract surgery, but still cataract surgery is one of the main surgery for glaucoma. So let's move to other glaucoma surgery. So we have the trabeculectomy, which is a gold standard for glaucoma surgery. And the reason this is a gold standard for glaucoma surgery is because this technique can be applied in various types of glaucoma. So as I showed you before in the slide before, we have many kinds of glaucoma. So to be able to treat different kinds of glaucoma in one technique is definitely a merit pro. But as you know, there's always a good part and a bad part. And the bad part is that this is a very invasive surgery that has a lot of risk of infection. Okay, and as another alternative for trabeculectomy, we have the express shunt. So this is still a filtration surgery, and this is not mixed. Don't be confused, but this is still a very invasive surgery. So, and this has a very similar outcome to trabeculectomy. And the pros for this surgery is that the post-operation follow-up and care is relatively easy. But again, as cons, demerits, we have this is a very invasive surgery, still invasive, and it has high risk of infection as well. Okay, now let's talk about some of the laser treatments. So for laser, I'm going to show you mainly two treatments. So we have the laser iridotomy, and this is more intended for close glaucoma, angle glaucoma. So this technique will use a yak laser or a green laser to make a hole, as you can see in this picture, to make a hole in the iris. Okay, and the pros for this surgery, for this technique, is it's very easy to do, very fast to do. The time of the surgery is very short, and it doesn't bleed. But of course, for cones, this has also a risk of inflammation, and also a risk of bullous keratopathy after the surgery, as you can see here in this picture. This is not necessarily a patient who have been done laser iridotomy, but this is an example of bullous keratopathy when the cornea becomes very opaque. For the next laser procedure, we have the laser trabeculoplasty. So this is more intended for open angle glaucoma, and this uses a very talked device, which is the SLT laser, but also can be with the ALT argon laser. So it will shut the pigmentation on the trabecular meshwork to drain the aqueous. And as you may know, SLT uses less power on the angle of the trabecular meshwork, and it only is activated, reacts to a pigmented area. And the good part, this is again is a very short treatment. It's a very quick treatment, and it doesn't bleed. But of course, we still have risk of anterior chamber inflammation. So these are mainly two different treatments, laser treatment, one for closure angle and one for open angle. And now let's talk a little bit about mix. So a mix is a technique of surgery that was developed relatively recently. And this is a shorthand for micro-invasive glaucoma surgery, or also minimally invasive glaucoma surgery. Okay, and this is a surgery technique. So some people is confused that the mix is these devices, but these are not the mix. These are just mixed devices. Okay, so mix itself is a surgery technique. So we have iStent, which is a gold standard for the mix procedure. It's a very low invasive that can be done even with cataract surgery combined. And then we have the Zen implantation. So this is a gelatin implant, about 6 millimeter. And this is good for primarily open angle glaucoma patient. And this procedure is done when the patient had failure for medical treatments. Okay. For the third mixed device, we have the CyPass, which is again for primarily open angle glaucoma patient. And this is more for patients who have mild to advanced glaucoma. So even for these three different devices, we have three different niche. As you can see, this can be done with cataract surgery. This is for patient. The Zen is for patients who have failed medical treatments and eye drops. And the CyPass is for more patients with advanced glaucoma. And for the next mixed category, we have the Cahook dual blade. So this is kind of a hook which has two blades here. And this will remove the tissue of the trabecular meshwork. Okay. So it's a very minimal invasive as well, and remove of the trabecular meshwork can be removed by the irrigation aspiration handpiece. So again, this is a procedure that can be done together with cataract surgery. And this is for open angle glaucoma. Of course, because we have to see the trabecular meshwork. For the next one, we have trabectome, which is a similar concept, a different method. So this one is again a hook that utilizes electronic knife. Okay, and it will remove again the trabecular meshwork, and it just needs a corneal incision of 1.7 millimeter. So it can be done again together with cataract surgery. And this again, we have to see the trabecular meshwork, so it's only for open angle glaucoma. So as you may know, MIGS now is a very common procedure. It's a very popular procedure among not only glaucoma specialists, but also for cataract specialists. So let's have a look into the relationship between MIGS surgery, MIGS procedures, and gonioscopy. So this one is the manual, user's manual of iStent. It's stating that the surgeon should perform gonioscopy before doing iStent. Okay, this is the manual, user manual for the CyPass. Again, gonioscopy should be performed. Also, you can look into some magazines. This is it was an article called Shaping MIGS Delivery. So again, this is emphasize the importance of gonioscopy. So as you can imagine, all the procedures with MIGS especially, but also glaucoma surgeries, we have to look at the angle. So if the doctor doesn't perform gonioscopy, it's going to be difficult for them to do the surgery. So I believe that gonioscope will be a good attention grabber for doctors to perform more gonioscopy. And it's going to be a solution for them because it's going to be easier to perform than the conventional gonioscopy. So we truly want to standardize this gonioscope as a screening examination and provide a solution for the doctors as well. So thank you very much for your attention. I appreciate your attention. And if you have any questions, we still have a couple of minutes. So you can write down on the question section. I will be answering from now. And of course, we will be following up if you have further questions. So please contact the salesperson in charge of your region.